Hi, my name is Shelby Norris. This is my week 11, chapter 11 discussion on medical malpractice. Number 1, the question says, what are some ways that miscommunication and communication errors can lead to malpractice in healthcare? One of the biggest ways that this can happen is if you have miscommunication on medicine that you're getting prescribed. It can be really detrimental to you if you're taking a medication that you're not supposed to be. Sometime if a doctor was misinformed on how to do a surgery or what to do during a certain situation and doesn't know, then that can lead to malpractice there. Even if they were to diagnose something wrong, or with the medication, if they diagnose something wrong, then that would also lead to medical malpractice, and all kinds of things like that. Or if a patient doesn't listen to their doctor, then that can also be malpractice on their part for not complying and not listening to what they were supposed to be doing. Number 2 says, should a provider be allowed to practice with a record of malpractices? Why or why not? I think if it were a situation that it was an accident and it was a one-time accident, humans are not perfect, and they never will be. So I think if a doctor makes an accident, it was an accidental and it hasn't been repeated, then I think that they should be able to keep providing. The only time I think that it does need to be taken away, their license need to be taken away over malpractice, is if it were a repeated offense, they're being careless, or if it was something on purpose, they did something messed up on purpose, and that would have been genuine malpractice. I think that people make mistakes, and if it was one time, then I think that they should not be able to have that stripped away. Number 3 is, should informed consent be used as a shield of legal liability in medical malpractices? Why or why not? I think informed consent should always be a thing. First of all, I think that everyone should have consent, and it should always be informed. But I don't think it should be used as a shield of legal malpractices, just because the patients are going to understand this risk and stuff. But I also just don't think that it's an excuse for doctors to mess up and be well, but I told you, and it just shouldn't be an excuse, I think. I do think that it is important at the end of the day, because it protects the doctor, because again, like I said earlier, that doctors are humans, so it protects them if they were very clear on what could happen. But I just don't think it should be excuse, if that makes sense. So yes, protection, but no, not as excuse. That's it. Thank you.